when we think about the current transmission rates of HIV, if we keep going at this rate, 1 in 2 Black men will be diagnosed in their lifetime. That's not okay, and unfortunately, I became one of those statistics. And I left the urgent care with no resources, no one to talk to, no pamphlet, no nothing. And I was like, what do I do? My name's Dimitri Moise. My pronouns are they, he, and I am living with HIV. A little bit about me. I am born and raised in Southeast Queens. I'm a proud Haitian American. I like to call myself a recovering Catholic, but spirituality and my faith in God is so important to me and always has been. I was unfortunately kicked out of my childhood church after I was outed, for being gay, and I ended up finding a community here in the city that I have been with now for 12 years. I went to school for musical theater. I had my start in the business on Broadway, and I was able to move into film, into TV, into commercial work. And I also went to university on an activism scholarship, so advocacy has always played a huge role in my life. It was around 2016, I started to look around at the business, and I realized there were a lot of issues that I put into the back of my head, a lot of microaggressions that I faced, and I got to a point where I realized I'm not sure that this is where I'm supposed to be forever, and that brought me back to my advocacy and back to my roots. And from that point on, I started diving myself back into all the communities that I've worked with my whole life. And then in 2018, I was diagnosed with HIV. I was managing a national magazine. It was a magazine geared toward millennial Black men, men of color, who were living their lives free of labels, free of gender construct. It was such a cool magazine, but I couldn't write, I couldn't do my work, my life stopped. And it was a huge turning point for me.
HIV stands for Human Immunodeficiency Virus, and HIV, when someone is infected, can impact their immune system. Our immune system is what protects us from other types of infections. And so what HIV does, it actually infects these little cells called T cells, and it kills them, and so your body doesn't have enough T cells to fight infections. When the T cells get below 200, it's at that point that we consider someone as having AIDS, acquired immunodeficiency syndrome, which means they are incredibly vulnerable or susceptible to having certain types of infections as well as cancers.
Sexual health has always been really important to me. I, got tested every 3 months. It was something that I have always been really educated about. I was getting really sick, and it felt like I had the flu. Just a really, really bad flu. And I felt that way for like 2-3 weeks. I was working on a show at that point, and I'd never missed a day, and I had to call out of work for 2 weeks. But then after those 2 weeks, I started to feel better, and I thought, oh, okay, maybe this flu is just passing. I didn't realize that I was seroconverting at that point. Seroconversion is when the HIV in your system now becomes detectable and present. And I started to feel better, and then a few months went by, and I got really sick again. And I was in and out of urgent cares and really couldn't figure out what was going on. And somewhere in that few weeks, I realized that I hadn't gotten tested in 6 months. And so I was like, oh my gosh, let me just get my test regular. I got a phone call, and the urgent care said over voicemail, hey, we need you to come in for your results. And I thought, that's really weird because I don't normally have to, go in and get my results. And looking back on it, I'm like, you should have known what was about to happen. But even still, you're not really thinking, you don't realize it until you hear the words, your test came back positive for HIV. And it was such a shock to me because I had spent so many years trying to get on preventative treatments, but I constantly got denied. I was traveling the country, and so at that point, doctors, providers weren't willing to give preventative medication to people who weren't their regular patients. And I said, you know what, screw it. I'm just gonna wait until I'm back home in New York. And unfortunately, life happened. One thing I remember vividly about my diagnosis was the doctor saying, you need to get on treatment immediately, but the first infectious care disease doctor we can get you to see is in 5 weeks. And I left the urgent care with no resources.
HIV has a disproportionate impact on the Black community. Almost half of new HIV diagnoses in the United States are among Black Americans. And even when we look at different subgroups, so if we look at, for instance, gay and bisexual men and other men who have sex with men, the majority of men who are diagnosed in that category are Black men. And similarly, when we look at Black cisgender women, so those are women who were assigned female sex at birth and identify as women, as well as transgender women, women who may have been assigned male at birth and identify as women. Among those two groups, we also see Black women disproportionately impacted by HIV. And over time, we've seen improvements in terms of lower HIV rates among white Americans, but Black Americans have not seen similar sort of gains or benefits in terms of the treatment and prevention that are available.
In terms of how the HIV affected my body, it's different for everyone. I experienced a lot of nausea, a lot of fatigue, and then I think mentally, I was putting myself and my body through a lot. I was feeling a lot of pain. I remember being able to feel my bones at one point, which I never felt before. And also, when I started taking my treatment, thinking about looking at that pill and saying okay, you got to take this every day for the rest of your life. The treatment that I take every day for my HIV helps suppress the virus so low that it gets to the point that it cannot be detected on a lab test. It's one pill once a day, with or without food. I can take it at any point in the day. I even now have this cute little pill box that says you're taking such good care of your health. And so it makes it easy, and I don't have to look at that pill bottle.
HIV treatment is really important for someone who's living with HIV in terms of for their own health as well as for public health. In terms of their own health, HIV treatment, when someone takes it, what it really does is it helps to prevent the HIV in their body from replicating, from making copies of itself. And so since it can't make copies of itself, it can't infect these T cells that I previously mentioned, and it can't weaken the immune system. So taking HIV treatment suppresses the viral load and makes it undetectable when we check for the viral load in a patient living with HIV. The benefit of HIV treatment for public health, if someone is taking their HIV treatment as prescribed and they have an undetectable viral load, they have effectively no risk of passing HIV on to their sexual partner. So it has both individual and public health benefits. There are a lot of stigmas that unfortunately still exist about HIV, even though we have really effective treatment and prevention. So sometimes people think that HIV can be acquired very easily, through kissing or using the same utensils, like spoons and forks as somebody, or being in the same room as someone, and that is not the case. You cannot get HIV from these very basic activities. HIV primarily in the United States is passed via sexual intercourse, and in a smaller number of folks via injection drug use. So we have many different ways that we can protect ourselves from getting HIV. One of the ways of protecting ourselves is through an approach called PrEP, pre-exposure prophylaxis. PrEP involves taking one pill a day for people who are HIV negative. And also involves going to see your doctor every few months to make sure you're getting checked on in terms of side effects, any other issues that you might be having, to receive counseling on how to stay safe. And so that bundle of care, the pill plus the regular visits with your doctor, is one way to stay HIV negative. We also know that there are condoms. We also encourage people to get HIV tested so that they know their status, and encourage them to also have their partners get tested as well.
So as someone who is Black, non-binary, gay, living with HIV, these days I've learned now how to really navigate the healthcare system, especially being a patient advocate. Now I've learned all the ways to advocate for myself. I know what to ask for. I know what to look for. I know the places where I can go. And so I think part of my work is being able to share that with other people. I get a lot of people who reach out to me who are newly diagnosed, or people who have been living with HIV and have questions, or want to learn more about disclosure methods or clinics where they can be able to find free treatments, or even just safe spaces for someone to talk to. It can be really difficult to walk into an urgent care or a random doctor's office, because how do you trust that person, right? And one of the important things for me was finding a provider who shares my experience. And so I have a provider who is also queer, also a person of color, and gets it, And those are all things that are really, really important when you're navigating the healthcare system. HIV is always put in this other. HIV, other STDs, STIs are put in this other, right? When HIV care is primary care. Sexual health is public health. And I think that also the healthcare system can do better in integrating HIV care into the primary care practice.
We need to ensure that all Americans, especially those disproportionately impacted by HIV, like Black Americans, have the access to HIV treatment and prevention that will keep them healthy. And the really helpful part is that there are lots of organizations, and there's also a lot of information out there for people to learn about HIV. The CDC has a website, Let's Stop HIV Together, where you can get lots of information about HIV prevention and treatment, and encourage all of you to go there. And there are also community-based organizations that are local and can also help provide education around how to stay safe.
So something that I would say to a person who's newly diagnosed with HIV is your life doesn't end with your diagnosis. For me, my diagnosis was a wake-up call. And at that point in my life, there were a lot of things going on that I wasn't addressing, I was putting away. And my diagnosis really forced me to take a look at myself and my life. And it also really showed me the people who support me and who love me. And even if you don't think you have someone in your corner, I promise you do have someone in your corner. And sometimes it might take a little sitting with yourself in silence. You might cry, you might scream, but just sit with yourself, and I promise you'll find that person who is in your corner.